Harka fuunee kabajamtootaa fi jaallatamtoota daawwattoota OROMIA11 akkam jirtu naga jirtu isiniin jecha sagantaa State Fairii Minnesota keessatti geggeeffamaa jiru amma immoo gara dipaartimentii addaa deemnee jirra. Gama kanaan waa'ee fayyaa ilaalla. Minnesota State Health Fairy tu jira. Gama kanaan immoo maal godhaa jiran. Gosoota dhibee garaagaraa as keessatti yaaluudhaaf sagantaawwan feerii garaagaraatu jira waan taateef ammas gama keessaatti nu wajjin deemaa isiniin jenna. Ogeeyyota fayyaa illee nu dubbisna, dipaartimentiilee fayyaa garaagaraatis nu dubbifna. Nu wajjin turtii gaarii qabaadha. Hi, how are you? What is your name?
My name is Cassie.
Hi, Cassie.
Hello.
What do you guys are doing here today?
So I'm with Cup Pharmacy, and we today are here offering flu shots at the fair. Obviously, today is the last day because it's the last day of the fair. But if anyone needs a vaccine in the future, they can go to any Cup Pharmacy, and we can definitely help you out there anytime we're open, Monday through well, actually 7 days a week. And we offer flu shots. The new COVID shot, when that comes out in a couple weeks, we'll be doing that. Shingle shots, tetanus shots, RSV shot that's coming out. So any vaccines that are available, we can help people out with. As far as if you don't have insurance, we can offer a cash price, that type of thing. But we're here to help the public. Make sure you're getting vaccinated, staying healthy, and trying to prevent, diseases that could put people in the hospital, make them very sick. So doing everything we can.
Tell me something that why I should take, COVID vaccine or flu shots.
So the flu, even though everyone thinks it's not a big deal, for a lot of people it can be a big deal. If you have a pre-existing medical condition like asthma or diabetes, or if you have cancer or something like that, just getting the flu could still put you in the hospital. It could cause, other infections like pneumonia, that type of thing. So people actually still die from the flu, even though people think that it is something that is not as big of a deal as it used to be. So that's why we do the flu shots, as well as we also see it as a way of if I'm staying healthy and I'm not getting the flu, I hope to try and keep you healthy by not passing it on to you as well, and other people around you that might not have as good of an immune system as you. So that's why we definitely recommend the flu shot. As far as the COVID vaccine, obviously COVID is still an issue. We've definitely seen an uptick in cases in the last month or two. Especially even locally. So anything we can do to try and keep ourselves healthy, not pass it on to, like I said, other people, just trying to anything we do to prevent. So,
do you have any specific message for the public regarding COVID?
I would say like any type of illness, it's always hand washing, of course. If you're feeling sick, stay home. Don't go into public places. If you feel like you might be passing it along, but you still need to go out, you could always still wear a mask. That is definitely an option, keeping your space. But yeah, the biggest thing is the hand washing, and then obviously just staying home if you're not feeling well, giving your body a chance to, heal from it and not pass it on to someone else. So,
thank you so much.
You're welcome. Have a good day.
What is your name and why are you guys here today?
My name's Mary. I'm a nurse. We work through Cub Foods Pharmacies, and we're giving flu shots free to the public today. We will be having COVID shots at the pharmacies later on in the season, hopefully October.
What is something that people should know about COVID?
That it really can be, the severity of it can be prevented for sure with the vaccine.
Can people have to take the vaccine?
They should, yes.
Why?
Why? Because if you do end up getting COVID, the symptoms will be much, much better.
Thank you.
You're welcome.
Hello, how are you?
Hi, I'm doing fine.
What is your name and what are you up to?
I'm Amar Subramanian. I'm a physician here at Health Partners. We are promoting a research study. What would happen is that if you sign up for this research study, we would look for your genes. And specifically, we're looking for 3 different syndromes, 2 of which increase your risk for cancers, and the other increases your risk for heart disease. And the idea is that if you learn about this information sooner rather than later, then we can try to prevent the cancers from coming.
How does your research help the public?
So the idea would be that if you know before, for example, if you're increased risk for breast cancer, then potentially you could do things to try to prevent that. So certainly there have been celebrities that have found out that they are positive for some of these genes, and they've had their breast removed prophylactically before they've had cancer.
How do you see about this year's state fair?
It's been good. It's been a little bit hot the last few days, and that so not as many people showed up as they have in the past.
Hi, how are you? What is your name?
I'm doing well. I'm Ray Blaylark.
What you guys are here today?
Well, I'm the founder and executive director of Sickle Cell Foundation of Minnesota. Sickle cell disease is a very serious blood disorder. Sickle cell disease is the most common genetic blood disorder in the entire world. There's about 100,000 people in the U.S., but there are over 5 million people in Africa. There's over 1 million people in India. It's a disease that most commonly, but not exclusively, but most commonly affects people whose ethnicity is from places where there was really bad malaria. And it's the way that people survived malaria. But now, with lots of movement around from country to country, the disease exists. And really, the disease is very serious. It's a very painful disease. Our red blood cells that all of us have that are shaped round like a donut and carry oxygen all around our body and to our organs, because they don't carry oxygen, they turn into this shape. And this is hard and sticky, and it gets clogged and stuck in the blood vessels. So if your blood is turning into this,
You can have the mic and just explain.
yeah. Yeah, so this is a model that was made by a medical student, and if your blood is flowing through your body and it's looking like these sickled shaped ones, right, like the croissant, it's going to get clogged in there. And then when you try to get your regular blood to flow, it's going to get stuck. You can't get your regular blood in. That's where pain happens. If this happens in your brain, you have a stroke. If this happens in other parts of the body, you have organ failure. Everywhere that blood flows is a complication. And it's important that we're getting the education and awareness out, because it affects so many black and brown people, and there is bias, there is misunderstanding, they're being undertreated, mistreated. It requires a lot of opioids, so the opioid overdose epidemic has not helped for those who require opioids medically. And so we're here to make sure that we are advocating for this patient population, and we're making sure that they are seen, that they are understood, and that they're treated well when they seek care.
What average of age you guys are working on?
So we work across the lifespan. So you're diagnosed at birth. You find out if you're born in the U.S., every single state tests for sickle cell disease at birth. So you will know if you have the disease. What you may not know is if you're a carrier, because that's going to be silent. That's not going to show up. And if you are a carrier, you're in the highest risk category for having a child with sickle cell disease if you have a child with a partner who also has sickle cell trait. So we have to educate. We have to make sure that people know and understand. And our job isn't to tell people if they should or shouldn't have children. If both you and your partner have sickle cell trait, our goal is to make sure you can make an informed decision that's right for your family and that's right for the future of your child.
Thank you so much. Do you have anything you want to add?
I just want to add that there's nothing to be ashamed of. What we have in our genes and what comes through in genetic patterns is not something that we have to be ashamed of. And we should not allow people to shame us for how we are made and what happens. And there was good reason for sickle cell trait, and now we simply deal with sickle cell disease.
Do you want to say something?
Not
is your
want to
name?
echo my name. My name is Ebony. I'm an ambassador of the Sickle Cell Foundation of Minnesota, and I just want to also echo what Ray said. We just really want to advocate for equitable health care and quality care along the lifespan for our sickle cell warriors.
What do you do as an ambassador?
As an ambassador, I just advocate, and I have those conversations. I do health coaching, and like I said, I do a lot of advocacy, speaking with our families, speaking with our warriors, helping them navigate systems and helping them just really get the support and resources that they need.
Do you have any message to the public about what you guys do?
The work that we do is just only a fraction of what needs to be done for the world. for those who are around the world living with sickle cell. So please join our cause, join our organization, learn more about sickle cell disease, become more aware of what's in your genetic makeup. And like she said, you don't have to be ashamed. You're wonderfully and beautifully made.
How are you? What is your name?
My name is Jeff Schaefer.
How do you, what do you guys are doing here today?
We have a booth about food allergies and anaphylaxis, which is a disease you get if you have an allergy to peanuts or something like that.
What is food allergy basically?
Food allergies, you could be allergic to pretty much any food. There are 9 major foods that cause allergies. Things like not only peanuts, but shellfish and fish and soy, things like that.
Why do you think food allergy exists to people?
Well, we don't really know, but one of the theories is that these days people are so sanitary that they don't get exposed to lots of germs or dirt, or everything is so clean that your immune system thinks the food is something bad.
Do you have anything to say to the public?
Our motto is take the fear out of food allergies. So we want people to not be afraid or scared that if they know they have food allergies, they should have epinephrine, like an EpiPen or AuviQ, and just know how to use these devices.
Sometimes, food allergies happen to the kids.
Yes.
How that the parent should aware of those kind of allergies?
It's important to make sure that you have the kids avoid the food they're allergic to. And also, when kids go to school, you have to work with a teacher and school nurse to make sure that the children at school are not exposed to these allergens.
Thank you.
Thanks for coming to our booth.
Hello, what is your name?
My name is Kevin Collis. I'm a nurse navigator for lung cancer.
What you guys are here today on State Fair?
Well, we're here talking about lung cancer screening for Minnesotans to help improve lung cancer survival rate here in Minnesota.
What is lung cancer, and for how long you guys have been doing this?
So lung cancer screening started in 2017, and it's for people ages 50 to 80 who are current or former smokers who have quit within the past 15 years. We do a low-dose lung cancer screening CT scan. We don't do it here. It's done through a primary care doctor. But we do a low-dose lung cancer screening CT scan with low-dose radiation. We look for spots on the lungs, and if we find a suspicious one, the hope is to remove it while we can still do surgery and it's curable, and before it spreads, basically. And so only 8% of people living in Minnesota have been screened for lung cancer. And so we're hoping to increase public awareness and increase those numbers because we know that lung cancer screening saves lives.
What is something people should know or should be aware of regarding their, lungs?
If you qualify for lung cancer screening, you should definitely see if you can get screened. We have high doses sometimes of radiation in our soil here in Minnesota, and so that can cause cancer. But if you want to test for radiation with a charcoal test kit, and so you can put that in your basement and look for radon levels in your basement. And so that's recommended in the winter here in Minnesota.
Do you have any advice for the public?
Don't start smoking. Don't avoid vaping if you can. The best thing is to prevent it altogether and limit your chance of getting lung cancer. 20% of all people diagnosed with lung cancer are non-smokers, so you could still get it, but it greatly reduces the risk if you avoid smoking or vaping.
Thank you.
You're welcome. Pleasure to do the interview.
Hello, how are you?
Fine, thank you.
What is your name?
My name is Tiffany.
Dar.
What are you guys are doing at State Fair today?
We are Minnesota Prevention and Recovery Alliance.
And we are here to just promote our organization. We work in the community. We're community based. We work across the state doing prevention, advocating harm reduction, education for youth and for adults in the community. So we're peer support specialists. We come alongside peers, our peers, youth and adults to support them in their recovery.
What else do you guys do?
She kind of summed it up. That's pretty much all that we do. We're like in schools and we're out in the community just helping people with the substance use disorder.
Do you guys have any programs regarding peoples of colors on recoveries?
I would say we don't have any specific programs that go specifically for people of color, but we do community events and we do go to different communities. So we've had events in the Somali community, we have events in the African American community, we have events in multicultural communities where we try to touch base with each ethnicity to give them the same message so that it's spread across the state.
What is one advice you want to give to, someone who want to start recovery?
Just to reach out because there's so many programs, not only our program, but there's so many really good programs and we meet people where they're at. And so just to reach out to get help, just to start living better.
Yeah, I agree with Dar. The biggest thing with recovery is just to have an open mind, have an open space, be willing to learn, be willing to just take a chance and do something different.
There is something called stigma in the society. How can we fight it?
Just more awareness about drug overdose, more awareness about programs, because addiction doesn't have just one ethnic group, one economic group, one of anything like poor. It could hit anybody. It could hit young people. That's why we go out into the community with our youth program, and so just raising awareness to help people.
Yeah, I think especially with our program, most of the people in the program have come from addiction and are in long-term sobriety. So to be able to see that we can function, you can do things, you can be at the state fair doing things like this and had been an alcoholic or a drug addict and recover from that hopefully will help remove the stigmatism that you're just alone and in a dark place.
Thank you, guys.
Yeah, you're welcome.
How are you?
I am very well, thank you.
And
I am fine too, thank you.
What is your name?
Bill Thurston.
And Sherry Thurston.
What do you guys are here and what do you guys are working on?
Well, we're co-directors for the KidSite program for Hennepin County, and we're doing vision screening for young children. Focus is very young children, but we are doing older also, but...
It's through the KidSite program that the Lions Club has. It's called KidSite. And we just go to different preschools, schools, public events like this where we do vision screening for kids looking for signs of a lazy eye, signs and symptoms. We have the scanner that we can just point at the child's eyes and within 5 seconds we can get a reading as to whether or not they're nearsighted, farsighted, crossed eyes, any of the symptoms that might be a lazy eye.
How does that work?
How does the camera work? Well,
I want you to demonstrate.
This is what we see when we have a normal vision with a child. And it says, and what it does is it takes different parameters for different ages, and then the camera itself looks at that parameter for the age group.
Basically, we just...
This is a screen that is abnormal, and it tells us that there was something found that was not in the parameter for that age group. So, and the reason we start early, because their age before they get into school sometimes cannot, if they find something, cannot be corrected before they're 7 years of age. So we try to get them before they even get in school.
Is this how you find out the kids have problem with their sight?
Yes.
Yes, exactly. When our program first started, it was 6 months to 6 years. But since COVID and since the kids have gotten so far behind on being screened, we now go up to age 16 or 17 years of age. So anybody that has a potential of something wrong, if we come up with that red screen, we give them a picture of that referral. We ask them to see an eye care professional just to check and make sure that they don't need glasses. We've gotten such positive feedback. People have stopped here all the time saying, you know, we were here last year, we went to the doctor, and now our child has glasses, or our child has surgery, or it's just heartwarming to know that we've done so much good in such a short amount of time.
And it's free through the Lions, through the Kid Sight program.
Do you have? Are you guys are working with the different communities of cultures?
Yes. The Kid Sight program, we, with the 5M district, there are 13 districts in the state of Minnesota. We go from Manitoba, Canada, down to the Iowa border, and we're divided into similar to counties. We are the directors for Hennepin County, but there are 12 other directors, actually 24, because we have 2 directors per district, and it sometimes takes that many to get around.
State fair, we screened every day, all 12 days of the fair, and each district took a day. Our district, because we're so local, we took 2 days, where we're here morning to night and just screened as many. I just did a tally, and so far we've screened 3,011 children. So,
are you guys familiar with the Oromos people from East Africa? Basically, have you heard about Ethiopia?
Ethiopia.
Ethiopia, of course.
So are you guys working with those communities too?
We go all over. Anybody that'll let us come in. I mean, I had a request from a minister in South Minneapolis.
I don't remember his name, but he asked if he would come to one of his events and do some screening there.
So if any community leaders reach out to you, your door is open, you mean?
Yeah. Yes. Yes.
Thank you so much.
Oh, you're welcome.
The lady is going to call you on
How are you? What is your name?
Hi, I'm Greg Abel. I'm doing fine.
What do you guys are up to today?
Well, today we're at the Minnesota State Fair, and we're promoting or educating people about gluten intolerance and celiac disease, and we also come out with a gluten-free list of food vendors at the State Fair, and you can see that on the green code.
Yeah.
And
well, can you explain about those a little bit?
different topics, questions, educates people about gluten intolerance or celiac disease, food products, some of the restaurants in the Minneapolis Twin Cities area that are dedicated to gluten-free.
So does gluten has a problem, like a health problem?
Well, it's a protein found in wheat, barley, or rye, are related grains. And so the human body has a certain genetic code. And so when you have those genes in your body, you're susceptible to celiac disease. So it's an autoimmune disorder. So something triggers the disease, and then the body goes and attacks the small intestine and destroys the villi where all the nutrients and minerals and vitamins are absorbed for human health. Those get blunted, so you're not getting those elements and proteins in your diet, and you feel miserable and just have all sorts of issues.
How do you reach out to the public?
Well, this would be one area we do it. We used to have a walk to raise money for awareness, but we no longer do that. So our public outreach is the fair and just our community with Facebook. And we have over 2,000 Facebook members. They're quite active there, people asking questions, navigating their diets.
Thank you.
Yep.
Egaan kabajamtoota daawwattoota Oromiyaa11 sagantaan fayyaa har'aaf isinii dhiyeessaa turre kana fakkaataa isteet feeriin bara kanaa bara 2023 asitti argamnee sagantaa hawaasaa waa'ee fayyaa keessa deemnee takka takkaan hawaasa kennaaf gaafiif deebii godhaa turre irraa waan hedduu barattanii jirtan jennee abdannaa bara dhufu isteet feerii biraatiin hanga walitti deebinuuf nagaan nuuf jiraadhaa isiniin jenna fayyaan faayaa of hin irraanfatinaa akkasumas dhibee koovid ammas deemaa jira waan ta'eef of eeggadhaa isiniin jenna.
Maqaan kiyya Dr. Elias Jama, pharmacistidha. So wannin dhaamsa qabu duraan dursee kan COVIDidha. COVID kana yoo namoonni shaatii hin fudhanne vaaksina yookaanis talaalee namoonni hin fudhanne akka fudhataniif ammallee COVID ni jira. So tanarratti waan dharaa miti waan dhugaati akka namuu COVID shaatii fudhatuuf hawwina. Yoo gaafii waa'ee COVID vaaksiinii kanaas yoo qabaattan nutti bilbila Sword Pharmacy yookaanis Access Clinic yookaanis doktara keessan bira godheexan gaafachuus ni dandeessanii. Ammallee vaaksiniin kennamaa jira namoonni fudhatan akka fudhataniif isin gaafanna.